expand jobs, boost pay. On 8th of August, NHS workers and supporters across the country will demonstrate to demand a 15% pay rise, something like but better than what France has already paid its health workers. The Labour Party would help on jobs more by backing these protests than it is by doing its jobs campaign, which it launched on the 31st of July. In the coming months, millions of furloughed workers are set to lose their jobs, and even more if it proves necessary to shut pubs and cafes again, as it could do. Over 500,000 young people leaving school and university are searching for jobs which aren't there. What we need: extend the furlough scheme and self-employed support schemes, drop the reintroduction of conditionality on universal credit, introduce a fallback, emergency basic or minimum income as a safety net, shorten the working week with no loss of pay to create more jobs with a standard working week of 4 days or 32 hours, expand directly employed public sector jobs in health, social care and other public services, expand council house building, take the manufacturing and aviation giants declaring job cuts into public ownership and reorganise their equipment and workforce skills towards green and socially useful production, take the banking and financial sector into public ownership and democratic control to restart investment. Despite escalating unemployment, the NHS is short 100,000 workers. Social care needs more workers to decasualise and stabilise its staffing. Local government needs to reverse the job cuts of recent years. Jobless bar workers cannot necessarily fill nursing vacancies, for example, but 50,000 registered nurses are currently not working in nursing. A proper pay rise and better conditions would draw many of them back into nursing and draw many into training. The official Labour campaign, by contrast, exists only in the media and on the web, not on the streets, and is vague. Reform the furlough scheme, back our businesses with a 1.7 billion business aid fund, additional support to areas forced into local lockdowns, boost sick pay, but by how much, invest in infrastructure, accelerate progress towards a zero carbon economy, boost public service jobs and pay, fight the pandemic, fight for jobs for all, and combat climate change at the same time. Nationalise social care. The Guardian reports the Department for Health and Social Care spokesperson saying there is no foundation to rumours that the government plans to bring social care under the umbrella of the NHS, but rumours remain widespread. We believe that social care must be made a public service, publicly owned and with its staff on secure public sector pay and conditions. Whatever the exact relation in future between a publicly owned social care service and the NHS, obviously it would have to be fairly close. Just pushing the existing privatised social care network under the NHS umbrella would mean more privatisation within the NHS, not more public care provision or improved standards for service users and workers. All the policy passed at last year's Labour Party conference was very clear that social care must be a comprehensively public system. Jeremy Corbyn's Labour leadership was pretty hesitant about arguing for that. Keir Starmer's flatly refuses. We need more debate in the Labour movement about the relationship between social care and the NHS, going beyond undefined buzzwords like integration. But no relationship will work well unless on the basis of the kind of policy Labour Party conference has called for: comprehensive public ownership of care.